Daily feeding tip. What are the top couple pediatric feeding disorders that we should know and recognize and maybe encounter if we're a pediatric feeding therapist? The top number one is definitely going to be developmental delays, because this is the main reason that children typically enter occupational therapy when they're very young. And something like 80 to 90% of children with a developmental delay will need feeding therapy and feeding support. The second, I would say, is autism or sensory processing differences. These are well-known conditions that affect both the sensory and motor processing of the whole body, meaning that feeding is often disturbed as well. Another one that we see commonly is premature birth. So babies who are born before their term date oftentimes are missing the coordination and reflexive components involved in feeding, causing them delays. You might have also heard of a condition called ARFID, which is basically just a fancy name for extreme picky eating. And then sometimes we see children with a condition called failure to thrive, which basically means that their feeding is so disrupted that they're not getting enough nutritional intake to grow the way that other children are. So these children are typically pretty small and underweight for their age, and they might be considering things like getting a feeding tube. Thanks for watching. If you enjoyed today's daily feeding tip, be sure to click subscribe below to join the Peds Feeding Tribe YouTube channel to get more content just like this and hear all my daily feeding tips.